Acute lymphocytic leukemia (ALL) is a type of cancer of the blood and bone marrow, the spongy tissue inside bones where blood cells are made. The word acute in acute lymphocytic leukemia comes from the fact that this disease progresses rapidly and creates immature blood cells rather than mature ones. The lymphocytic in acute lymphocytic leukemia refers to a white blood cells called lymphocytes, which ALL affects. Acute lymphocytic leukemia is also known as acute lymphoblastic leukemia. Acute lymphocytic leukemia is the most common type of cancer in children, and treatment results in a good chance of cure. Acute lymphocytic leukemia can also occur in adults, though the chance of cure is greatly reduced. Symptoms. Signs and symptoms of acute lymphocytic leukemia may include bleeding from the gums, bone pain, fever, frequent infections, frequent or severe nosebleeds, lumps caused by swollen lymph nodes in and around the neck, underarm, abdomen or groin, pale skin, shortness of breath, weakness, fatigue or general decrease in energy. Causes. Acute lymphocytic leukemia occurs when a bone marrow cell develops error in its DNA. The error tells the cells to continue growing and dividing when a healthy cell would normally stop dividing and die. When this happens, blood cell production becomes abnormal. The bone marrow produces immature cells that develop into leukemic white blood cells called lymphoblasts. These abnormal cells are unable to function properly and they can build up and crowd out healthy cells. It's not clear what causes the DNA mutation that can lead to acute lymphocytic leukemia, but doctors have found that most cases of acute lymphocytic leukemia are not inherited. Risk factors. Factors that may increase the risk of acute lymphocytic leukemia include previous cancer treatment. Children and adults who have had certain types of chemotherapy and radiation therapy for other kinds of cancer may have an increased risk of developing acute lymphocytic leukemia. Exposure to radiation. People exposed to a very high levels of radiation, such as survivors of a nuclear reactor accident, have an increased risk of developing acute lymphocytic leukemia. Genetic disorders. Certain genetic disorders, such as Down syndrome, are associated with an increased risk of acute lymphocytic leukemia. Having a brother or sister with ALL. People who have a sibling, including a twin with acute lymphocytic leukemia, have an increased risk of ALL. Tests and diagnosis. Tests and procedure used to diagnose acute lymphocytic leukemia include
blood test.
A blood test may reveal too many white blood cells, not enough red blood cells, and not enough platelets. A blood test may also show the presence of blood cells, immature cells normally found in the bone marrow but not circulating in the blood. Bone marrow test. During bone marrow aspiration, a needle is used to remove a sample of bone marrow from the bone. The sample is sent to a lab for testing to look for leukemic cells. Doctors in the lab will classify blood cells into specific types based on their size, shape, and other features. They also look for certain changes in the cancer cells and determine whether the leukemia cells began from the B lymphocytes or T lymphocytes. This information helps your doctor with a treatment plan. Imaging tests. Imaging tests such as X-ray, computerized tomography scan, or ultrasound scan can help determine whether cancer has spread to the brain and spinal cord or other parts of the body. Spinal fluid test. A lumbar puncture test, also called a spine tap, may be used to collect a sample of spinal fluid, the fluid that surrounds the brain and spinal cord. The sample is tested to see whether cancer cells have spread to the spinal fluid. Treatments and drugs. In general, treatments for acute lymphocytic leukemia falls into separate phases. Induction therapy. The purpose of first phase of treatment is to kill most of the leukemic cells in the blood and bone marrow and to restore normal blood cell production. Consolidation therapy, also called post-remission therapy. This phase of treatment is aimed at destroying any remaining leukemia in the body, such as in the brain or spinal cord. Maintenance therapy. The third phase of treatment prevents leukemic cells from regrowing. The treatment used in this stage are often given at much lower doses over a long period of time, often years. Preventive treatments to the spinal cord. People with acute lymphocytic leukemia may also receive treatments to kill leukemia cells located in the central nervous system during each phase of therapy. In this type of treatment, chemotherapy drugs are often injected directly into the fluids that covers the spinal cord. Depending on your situation, the phases of treatment for acute lymphocytic leukemia can span 2 to 3 years. Treatments may include chemotherapy. Chemotherapy, which uses drugs to kill cancer cells, is typically used as an induction therapy for children and adults with acute lymphocytic leukemia. Chemotherapy drugs can also be used in the consolidation and maintenance phases. Targeted drug therapy. Targeted drugs attack specific abnormalities present in cancer cells that help them grow and thrive. A certain abnormality called the Philadelphia chromosome is found in some people with acute lymphocytic leukemia. For these people, targeted drugs may be used to attack cells that contain that abnormality. Targeted cells include imatinib Gleevec, dasatinib Splicel, nilotinib Tasigna. These drugs are approved only for people with Philadelphia chromosome positive form of ALL and can be taken during or after chemotherapy. Radiation therapy. Radiation therapy uses high-powered beams such as X-rays to kill cancer cells. If the cancer cells have spread to the central nervous system, your doctor may recommend radiation therapy. Stem cell transplant. A stem cell transplant may be used as consolidation therapy in a people at high risk of relapse or for treating relapses when it occurs. This procedure allows someone with leukemia to re-establish healthy stem cells by replacing leukemic bone marrow with leukemia-free marrow from a healthy person. A stem cell transplant begins with high doses of chemotherapy or radiation to destroy any leukemia-producing bone marrow. The marrow is then replaced by bone marrow from a compatible donor, allogenic transplant. Clinical trials. Clinical trials are experiments to test new cancer treatments and new ways of using existing treatments. While clinical trials give you or your child a chance to try the latest cancer treatment, treatment benefits and risk may be uncertain. Discuss the benefits and risks of clinical trials with your doctor. ALL in older adults. Older adults, such as those older than 60, tend to experience more complications from ALL treatments, and older adults generally have a worse prognosis than children who are treated for ALL. Discuss your options with your doctor based on your overall health and your goals and preferences. You may decide to undergo treatment for your ALL. Some people may choose to forego treatment for the cancer, instead focusing on treatments that improve their symptoms and help them make the most of the time they have remaining. Alternative medicine. No alternative treatments have been proved to cure acute lymphocytic leukemia, but some alternative therapies may help ease the side effects of cancer treatment and make you or your child more comfortable. Discuss your option with your doctor, as some alternative treatments could interfere with cancer treatment, such as chemotherapy. Alternative treatments that may ease signs and symptoms include acupuncture, aromatherapy, massage, meditation, relaxation exercises, coping and sport. Although treatment for acute lymphocytic leukemia is typically very successful, it can be a long road. Treatment often lasts 2.5 to 3.5 years, although the first 3 to 6 months are the most intense. During maintenance phases, children can usually live a relatively normal life and go back to school, and adults may be able to continue working. To help you cope, try to learn enough about leukemia to feel comfortable making treatment decisions. Ask your doctor to write down as much information about your specific disease as possible. Then narrow your search for information accordingly. Write down questions you want to ask your doctor before each appointment and look for information in your local library on the internet. Good sources include the National Cancer Institute, the American Cancer Society, and the Leukemia and Lymphoma Society. Lean on your whole healthcare team. At major medical centers and pediatric cancer centers, your healthcare team may include psychologists, psychiatrists, recreation therapists, child life workers, teachers, dietitians, chaplains, and social workers. These professionals can help with a whole host of issues, including explaining procedures to children, finding financial assistance, and arranging for housing during treatment. Do not hesitate to rely on their expertise. Explore programs for children with cancer. Major medical centers and non-profit groups offer numerous activities and services specifically for children with cancer and their families. Examples include summer camps, support groups for siblings, and wish granting programs. Ask your healthcare team about programs in your area. Help family and friends understand your situation. Set up a free personalized web page at the not-for-profit website Caring Bridge. This allows you to tell the whole family about appointments, treatments, setbacks, and reasons to celebrate.